Now, this is a very interesting Hrct of the chest where we can tell very nice findings. Now, when we zoom in, what we can see, I want to highlight two things that this definitely, whenever we want to trace the lungs, we have to trace the lung like this. This is all lung border, and that is all concave. And you can see this is all left-sided lung, and this is all right-sided lung. The margin is very very smooth, and there should be more of a this type of thing. There, the lower margin should be concave, and this is the complete margin of lungs. So you simply have to trace these margins from in all the lung fields. This is how it is easy to find out whether the patient has pleural effusion or not, because if the patient has pleural effusion, it will simply take the shape of this concavity first, and it will be in a dependent part. So this is the dependent part because this is the back. The patient is lying down on this position, on the lying back. So we can see pleural effusion earliest in here because that will be dependent part, and that will be in along the lung margin or along the rib margin going up. So in here we can see that there is a very dense lesion, hyperdense lesion. So whether there is consolidation or effusion, there can be this one small confusion. So to find it out, if it is pleural effusion, that will be more of a homogeneous. It will be like white out. So if you can very closely see, such hyperdensity can be because of pneumonia or consolidation, or that can be because of pleural effusion. So pleural effusion, as we know, is more of a collection of fluid. So it is collection of pleural fluid, and consolidation is all collection of protein-rich exudates in alveoli. So this protein-rich alveolar exudate will definitely have more white attenuation or more white hyperdensity. So it will be more dense than fluid which is liquid. So liquid will appear slightly blacker or slightly radio uh, lucent compared to the pneumonia. One more thing, whenever we are talking about pneumonia, we can see a patchiness. So this patchiness will not be there in effusion. If effusion is there, it will be more of a homogeneous. Whereas in consolidation, as it involves multiple subunits of alveoli, there will be patchiness. The presence of air bronchogram is basically uh, visibility of air in patent bronchus. That typically tells that yes, there is consolidation. So air bronchogram patchiness will definitely tell us that there is consolidation. Now here what we see is this is a patent bronchus and there is air inside. It means that this is pneumonia. This is consolidation patch, and you can see the patchiness, that there is patchiness. There is some air. So if there would have been effusion here, they should not have been here. So here we can see the air is there. It means this is not effusion, or effusion may be present but underlying this is also air bronchogram. This is also air bronchogram, that is air in the patent bronchus. This is also air bronchogram. This is basically air in patent bronchus. So patient definitely has if consolidation. Here also we have air bronchogram, that is presence of air in patent bronchus. Now whether this patient has effusion or not, you can simply zoom in and you can try to find it out. Now when we zoom in, you have to look very closely that here which I am marking is a definite two layers. So this is more of a all homogeneous. This looks less hyperdense than this whiteness. So compare this whiteness or this whiteness to this whiteness. This is less hyperdense and this is more of a uniform, and this is acquiring the shape of the concavity of these along the lung border. Here also, if you can see this, this is the a clear cut, lesser radiolucent shadow, which suggests that there is underlying pleural effusion beneath this patch of consolidation. So definitely this is much more hyperdense or whitish, and this is lesser hyperdense or lesser whitish, and this is typically pleural effusion. So this HRCT typically shows bilateral extensive consolidations with bilateral pleural effusion. Thank you.